In 2014, Gainesville Fire Rescue noticed that our 911 calls were going significantly upwards without a means to meet that demand, and thus the need for community paramedicine began here in the city of Gainesville.
What we noticed was our crews were going to some of the same patients every day, evaluate this person for a medical problem, ask them if they would like to go to the hospital. We would facilitate them being transported to the hospital, and then they would be released and they would call us back the next day. So eventually we had to ask ourselves, are we actually solving their greater problem? And that kicked off our questioning of what else can we do to actually help this person. And we found that a lot of times it was not a medical problem, that it was a social problem. And that led us to go through a design thinking process that got us to the current model that we use. So we pair a GFR paramedic who's trained to the advanced life support level with an emergency medical technician that's also trained as a healthcare worker.
Our CRP techs go on visits with paramedics, and the paramedics play a major role in our Community Resource Paramedic program. We go out as a team, and the paramedic helps identify medications, coach the patient on their medical interventions, as well as doing home safety assessments.
The majority of our referrals come from the fire department. They run a 911 call, they see stuff on scene that maybe we could help with, and then they're able to put in a referral to us, and we can go out and follow up with the patients in their homes. We work with 4 UF health clinics mainly, as well as some social providers in the community.
Our partnership with CRP definitely has allowed us to expand our services to our patients. We started initially a few years ago when the program started, and we've really built a strong partnership with patients that we have that are high needs, that are very disadvantaged as well. And so they've been able to go into the home and they provide a needs assessment and a view of the patient's life that we don't necessarily get here in the clinic.
Just having them in the home and able to kind of see the environment in which the patients are living in, even what they're eating, that gives us better insight on how we need to go with their treatment plans.
The results of community paramedicine here has been significant. We've been able to reduce emergency room visits by about 30% and hospital admissions by 60%. And both of those values hold a significant cost savings, not just to the patients, but to our healthcare system and insurance companies as well. So it really truly is a win-win for the patients and the providers.
I'm able to do a little bit more than what I was from the beginning, because I wasn't able to do anything. I wasn't functional enough to know any better how to do things. So, but then they came in, they helped me, and I appreciate what they did for me.
Along with our paramedic and resource technician team, we have an army of students that are key players in connecting the patient's needs to the resource in the community.
We have a very unique program in the center. We have the only undergraduate academic program dedicated to health disparities in the entire nation. So this project was a unique opportunity to involve students in community-based learning so that they could see the application of everything they're learning in the classroom in a real-world setting.
Are you interested at this time in changing anything?
What I'm changing right now is I'm cleaning up my environment, and I'm exercising more, and I'm
Community paramedicine is an easily scalable model because the fire department is already so embedded in the community. In order for us to achieve community health goals, it's simply a matter of introducing new training and getting out there. I think that our program's model can definitely be used outside of just Alachua County and the city of Gainesville, and potentially, spread into other counties and then outside of Florida.
So I love working with CRP because I do see that difference in their lives. When I first go into their homes, they're usually a little bit shy. They might not know a lot about their own health, but by the time I leave, they're able to call resources on their own, schedule their own doctor's appointments, and get all the health resources they need to be advocates for themselves and their own health care.
They come along, they help me, and I've been ever since December last year. I've been on track. I'm better. I'm much better. I come a long ways.